Hi, my name is Sarah Smith-Putman, and I am here at Chester River Behavioral Health. We're a mental health facility, actually health and wellness now. I've been working here since 2006, and as of January the 1st became a partner with Teresa Schaefer and Rick Wirtz. And I've worked with alcoholics, addicts, their families, their spouses, since, let me think here, oh my goodness, 1998, I believe, is when I started. I continue to work with mainly adult children of alcoholics, codependents, and I also work with couples, sometimes who have these issues and sometimes who don't. And I also work with folks that have anxiety, depression, PTSD, and those kinds of things. I guess I see two kinds of sort of folks that end up in my office who are adult children of alcoholics. The first would be, I guess you would call the rebel or the scapegoat, or the ones that have the genetics for alcoholism or addiction and just sort of end up sort of following in the footsteps of their drinking or using parents. And they have troubles from their own use. They also have trouble from the family they grew up in. So they end up in here many times legally referred and maybe not wanting to be here yet. But the second, and the ones, the folks I'm working with more in my therapy groups right now that are self-referred, are those that were sort of the hero of the family. A lot of times they avoided doing all of those things purposely because they saw what alcoholism or addiction did to their family, and they really were like, I'm going to avoid this at all costs, I'm going to make sure I never go near that. But they end up having a whole host of other problems. They are very codependent. They are the folks that take care of everybody and everything. They were probably the ones in their family that were parentified or ended up parenting their siblings or even their parents. So they were like little parents. And in being little parents, they were not able to participate the way their peers would have been in sort of the things you would be doing at that age, learning how to interact with other kids, learning what you like to do, learning what's fun, finding hobbies and interests and all those other things. So a lot of times they go throughout life taking care of, get married, take care of a spouse, take care of children, and at some point in their lives they're so overwhelmed with taking care of everybody, probably still their parents and still their siblings and everybody else, and they have no idea who they are, what they like, what they feel like, what their emotions are, and they kind of feel crazy. And so a lot of times when they come in here, they'll come in with anxiety. And they might be taking medication, they might feel a little depressed, the medication may not be working that well, and they just feel like, I don't know what's wrong with me. I'm crazy. And then I'll get some information from them and talk about their family history. I'm like, not crazy, codependent. So that's kind of how I get clients from alcoholic families. They don't come in and say, I need to see you because I'm an adult child of an alcoholic. Yeah, they come in because they feel anxious and overwhelmed.
Right.
Yeah. If you have spent all of your life taking care of folks and you're good at it because you've been doing it since the time you were 5 years old sometimes, it's difficult to stop. It's almost like an addict stopping the use of whatever their drug is. Stopping taking care of and saying yes to everything is very hard. So it's really causing sort of trauma and stress in their lives, but they can't stop it. And then trying to stop it is extremely uncomfortable. And then when you do stop it and the focus is just on you and you don't know who you are, then that's very, very difficult. So that, I guess, is what I would see. And one of the biggest things I hear from folks who finally realize, okay, this is my issue, I'm ACOA, is they don't understand what's normal. And I hear that all the time. Sarah, is this normal? Is this normal? You know, and I used to, I think I was telling you before, I used to say sort of like, well, it doesn't matter what's normal for me, it matters what's normal for you. But then I realized I don't really have a clue. Really want me to tell them, or at least an idea of what sort of normal is. You're so used to taking care of everybody else in your life, and you keep yourself very sort of busy and chaotic with doing that. So you don't have to focus in on all the pain, all the shame, all the fear that you have, anger, anything that you may have been feeling forever. You don't have to look at it if you're taking care of everybody else. First of all, as a child, if you have alcoholic parents, whether they're acting out or not, you know something's not right, so you don't want to bring your friends over, and you don't want to go over other places because you may not know how to act correctly. So I think you just sort of, you know something's wrong with your family. You don't want to tell people something's wrong. Usually you're very loyal and defending of what's going on here, but you know in there that it's not right. And so you carry that shame, especially if the parents are not owning up to any of the issue. So I think sometimes you have folks whose parents were alcoholic and at least they talk to their kids about it and said, I have a problem, I have an issue, I'm working on it, I know it's not right. I think that helps. But if you have two parents or one parent and one codependent and the craziness is just going on all the time, you know it's not right. And you're ashamed. You sure don't want anybody else to see it. And even after talking to people for weeks and weeks and, years, sometimes they'll tell me something after years of being in therapy about their family, not even about them. They didn't want to tell me before because they were ashamed. When I have somebody come in here, the minute they sort of understand what ACOA is or what codependency is, once they grasp it and they accept that, oh yeah, that's me. So a lot of times people are like, oh yeah, that's me. The minute they come in here, they're like, oh my gosh, that's what it is. It's almost like an epiphany sometimes. I try and get them into a group when they're there, because a lot of times they feel like they're the only person in the world that's so confused and so abnormal and walking around, sort of wondering. The other thing that I think ACOA has, they always think people are judging them harshly. So they do a lot of mind reading, and so they feel very, they have low self-esteem, and they think people are constantly figuring out there's something wrong with me. Well, you can imagine their relationships are sort of all built on, what can I do for you? And they're not equal. So, they don't have equal relationships. They sort of have relationships where I'm doing everything for you and I'm giving and you're taking. And that's the way it's set up. So they choose people, well, probably unconsciously, that are takers. And that's how these relationships fit. Just like as we were talking, if you need an enabler, you're gonna find that person, right? So yeah, they find themselves with a lot of relationships at some point when we talk about setting boundaries with sort of toxic people that are just taking from them. And then they have a skewed view of the world, because if you've surrounded yourself with people that sort of take advantage of you, then you kind of think that's the way the world is. So you add to that sense of, right, well, you learn how to say no, right, to whatever it is. You have to recognize how you feel. You have to recognize what you need to do for yourself. You have to put the needs of yourself first, and then look at what other people need. And that's what they're not used to doing. And I sort of define it as, because then I hear, but I don't want to be a selfish person, and I don't want to, not do something nice for somebody, and of course not. So at the core of every codependent person is a really giving, really nice, caring person. That's why I like working with them. They're the nicest people on the planet, but there needs to be a boundary, right? So they have to find that. So if the care of someone else is causing detriment to you, then you need to stop it. I think one thing probably is if you've found yourself in a series of relationships that are, harmful or not good. And I've had a lot of folks who have no clue that either parent was an alcoholic or an addict, and still, for whatever the reason, whether the parents were just really good at hiding it, or because there was, some other things can cause this feeling for folks. If you had a workaholic parent, if you have non-nurturing parents or parent, if you did not have, I would say, non-nurturing parents. So if neither parent was nurturing to you, you may have a lot of these symptoms, and then feel really like, what's wrong with me? I mean, there was nothing wrong with my parents. But if you did not have a parent that was nurturing, you may have all of those feelings of not being able to connect with people, of not understanding what your own feelings are, of being taken advantage of a lot in relationships, and ending up in one sort of poor relationship after another.
Mm-hmm.
So I guess that would be something, because I see that more and more, and I've had clients who have had maybe a parent who was mentally ill, or just a parent who was self-consumed. I mean, they may not, but the result is the same. You know, whether it's alcohol or just, you know, narcissism. If someone is not sort of helping a child, giving them what they need, then they end up, you know, not knowing. And so I guess that's what I'd like to say is I would encourage anybody who has any of those symptoms, you know, to get therapy, get help for it, go to the groups that are out there, the self-help